About ablation for liver cancer. You have been recommended to undergo ablation to treat your liver cancer. This film will give you more information about the treatment, what you can do to prepare, and what you can expect during your recovery. As always, please speak to your healthcare team if you would like any more information. Ablation is a minimally invasive procedure for liver cancer that treats small or large tumors using heat or cold, and may be used if you cannot or choose not to have surgery. It may also be carried out in combination with treatments such as radiotherapy, chemotherapy, and surgery. There are different types of ablation therapies. In this film, we will cover 3 of the most common types: microwave ablation, radiofrequency ablation, and cryoablation. Your healthcare team will explain to you why they have recommended a certain type of procedure. Before having a microwave ablation, you may either be given a general anesthetic intravenously to make you sleepy, or you may be sedated and be unconscious for the treatment. During the procedure, the doctor will place a needle into the tumor under the guidance of a CT scan or ultrasound. Once in the right position, microwave energy is passed through the needle into the tissue. This energy heats up the cells in the tumor and destroys them. The procedure is completed once there appears to be no remaining tumor in the treated area. Radiofrequency ablation is carried out in the same way as microwave ablation, but with using a different type of energy. Here, the doctor uses a needle called an electrode and applies an electrical current, causing heat and destroying the tumor. Cryoablation uses a similar method, but it involves inserting a cryoprobe into the tumor. Instead of being destroyed by heat, the tumor is frozen and destroyed. Ablation can also be performed laparoscopically or as an open procedure. In these cases, the procedure will be carried out by a well-trained surgeon in an operating room. What to expect on the day? Depending on the type of procedure you are having, you may be taken to the radiology department or an operating theater. An interventional radiologist or surgeon will talk you through the procedure and answer any questions. You can expect to be given a gown and guided to where you will have your procedure. Ablation is a quick procedure, typically taking 5 to 10 minutes, but may be longer depending on the size of the tumor, and recovery is quicker. What happens after an ablation procedure? After the surgery, you will be looked after in a high-dependency ward while you recover. A period of observation is required after this intervention, in which your healthcare team will be able to offer any pain relief medication required. This procedure will sometimes be completed without you needing to stay in the hospital, with you being able to return home the same day, but in most cases, you may be required to stay overnight. Following an overnight stay, you may be able to go home. Your healthcare team will discuss any necessary follow-up treatment or appointments needed. Possible complications. Like any procedure, ablation has its side effects and risks. For example, you may have some pain or discomfort, feel slightly unwell, and there is a risk of infection and postoperative bleeding in the area that was treated. Your healthcare team will be there to help you manage any symptoms appropriately. Remember that everyone's experience is different, so it is important that you work closely with your healthcare team. They will advise you throughout your treatment journey.